A polio response update was held today by the Polio Outbreak Response National Emergency Operations Center. The Health Department reported that on the 31st of July, they received 47 samples of people with acute flaccid paralysis. Of this, only 21 sample results were received, 2 of which were polio. The 2 samples were the initial cases reported in June.
A new confirmed polio case in Ley that a 1-year-old child presented to Angao Memorial General Hospital on the 3rd of July 2018 with acute flaccid paralysis. The date of onset occurred before the first round of immunization took place in Ley. On 27 July, the National Department of Health has confirmed that the child from Ley, Morobe province tested positive for poliovirus. This was based on the laboratory confirmation made by the Victorian Infectious Diseases Reference Laboratory, a WHO reference laboratory based in Australia. The department is still to receive the final laboratory confirmation from the US Center for Disease Control and Prevention to find out if there is a linkage between this boy and the first case detected in Ley, Morobe province.
Reported as investigated, and a sample was collected and sent to laboratory for the confirmation. I want to make it clear, not every cases or AFP cases or people call suspected cases is a polio cases.
Following the reported case, the first vaccination rounds have reached 86% coverage for the 3 provinces combined. Health Secretary Pascoe Kase says these figures are expected to rise as reports are still coming in from remote areas in Madang.
As a consequence of the success of this campaign, more and more children presented for vaccinations than expected. We are required to purchase additional vaccines to cover the second round.
The second round of the campaign is scheduled for August 20 to September 20 in the 3 provinces.
We encourage people to go to the public institution like Gerehu Hospital or Port Moresby General Hospital. So you only pay 12 kina 50 toa. But those in Madang, Ley, and Morobe, Madang and Eastern Highlands, our children are free of charge.
UNICEF has also supported the campaign through the polio supplementary immunization activity, social mobilization, and human resources for polio surge capacity. Meanwhile, the Health Department announced that the government will have 2 million kina funding available by the end of today. Merlin Diaukatam, National EMTV News.